Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
To the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. Today, we are going to talk about the perineum. There is a big new trend in health and wellness regarding perineum tanning. So we're going to talk about this trend, the pros and cons of it, as well as issues relating to the perineal area, including the anatomy and physiology of what specifically it is and does, and episiotomies as well as waxing in that area. First up, we're going to start, as usual, with the anatomy and physiology. We want to know the structure and function of this part of the body so that we can really understand what it is, what it does, and how it impacts our life in many different ways we may not be aware of. So what is the perineum? The perineum is that region of your body between your thighs and directly below the pelvic diaphragm. To put that in context, it's that little smooth area that is between your anus and your genital area. And the boundaries of this region are really similar for that of your pelvic outlet. So your pubic symphysis, which is where the two sides of the pubic bone form in your body. So when you're looking at your bones, just straight up as a skeleton, you have the pelvic area, referred to as the pelvic girdle. And normally when you see it, it's articulated together with the sacrum and the coccyx in the back, and then the large fan-like bladed projections at the top. And those are referred to as the ilia, or in the singular form, ilium. In the front, where these bones meet together, you have the pubic symphyses, and that just pretty much means that it is joining the pubic bones together. So that hard area that you feel, those bones that you can feel underneath your mons pubis, is really your pubic symphysis. The part that you sit on and that you sometimes hear referred to as your sit bones in different types of fitness programs, including yoga or perhaps P90X, are your ischia or ischium when it is singular. By adulthood, these are all fused together. The ilium, the ischium, and the pubic symphysis on each half of your pelvis. So these are really in two different components, although we normally see them articulated. In the front, they're connected at the pubic symphysis by some cartilage, as well as some ligaments and tendons to help hold them in there. And in the back, the actual sacrum, which has your coccyx or your tailbone at the bottom, is attached at a place on each side of the sacrum that's referred to as the auricular surface. And that's because the auricular surface is ear-shaped, almost, in appearance. So you really have three bones that are making up this area, or three sets of bones, to be honest, because they are fused typically in adulthood, but technically the ischium, the pubic symphysis, and the ilium are different bones, as is your sacrum and your coccyx. So this is what really makes up your pelvic girdle. And these bones have the pubic symphysis in the front and the sacrum with the tailbone in the back. The ilia attached to the sacrum and the ischia are the parts that we sit on, our sit bones, as they refer to them. So, in your body, your sacrum connects at the top of it, at the sacral promontory, to your spine, the rest of your axial skeleton. Remember, our appendicular skeleton refers to our appendages, like our arms and our legs, whereas our axial skeleton is the spinal cord portion and the cranium, the skull, the part that is along the midline of your body. So your thigh bones, or your femora, attach into that ball and socket joint within the pelvic girdle. And then above the sacrum is where your lumbar vertebrae connect. And then above that, your thoracic vertebrae, the ones that have attachment sites to your ribs. And above that are your cervical vertebrae, which are essentially your neck, all the way up to the very bottom of your cranium, which is your skull minus your jaw. And when that's all together, it's referred to as a skull. If you have your whole cranium and the jaw/mandible there, then that is referred to as a skull within the science of skeletal anatomy. And those top two cervical vertebrae are referred to sometimes as the atlas and the axis, or C1 and C2. And they're what form the junction with your skull at the very base, your cranium at the base. Right around the hole called the foramen magnum, which just means big hole, that goes into your cranium to attach your brain to your spinal column, or the brain and brain stem components. So those all lead down through your spinal cord and through those vertebrae down to your sacrum. And at the sacrum, you may have noticed, if you've ever looked at a pelvis, that it has a lot of holes in it. And these sacral foramina, or these holes within your sacrum, are there to allow for your blood vessels and for your nerves to go out to the rest of your body. And this area is sometimes referred to as the horse's tail, because it looks like a horse's tail kind of fanned out when you see all of the nerves going out to where they need to be. So in this way, this is how your axial skeleton is set up, and this is what the anatomy of your perineal area looks like, at least on the skeletal aspect. So, the boundaries for your perineum are very similar to your pelvic outlet. They are the pubic symphysis in the front, the ischiopubic rami, which are where your ischium and your pubic symphysis come together once they are fused in adulthood. And then you have those sacrotuberous ligaments that are holding your sacrum and everything in together in the back, and your coccyx, referred to as your tailbone. In addition to these sacrotuberous ligaments, there are a few other types of soft tissues that are involved in forming your perineal area. The perineum has a roof, more or less, that is formed by the pelvic diaphragm, which is a muscle area, and also a floor of fascia and skin. So when we say fascia, think about when you're cutting up some meat and you see kind of like that silverish or whitish area over it that's not fat. It's a protective area over your muscles. So that's what we're really talking about here. And it also contains the muscles and the neurovasculature, or the nerves and the blood vessels that are necessary for associated urogenital structures and the anus. When you pull the legs away from the body, referred to as leg abduction, then your perineum forms a diamond shape, and you can divide that into two triangles anatomically by drawing a line connecting the ischial tuberosities. So the ischial tuberosities, those are those hard parts that you're sitting on, and if you see them in skeletons, they're really roughened, And places that are roughened on your bones are because they have a lot of attachment sites on them. So that's where the muscles are attached to the bones via ligaments and tendons, where bones are attached to bones, and so on and so forth. So they need to be rough so that the different ligaments and tendons have something to grip onto. When we draw this line connecting the ischial tuberosities, above that up to the pubic symphysis, which on women is located just above the clitoris, is going to be the urogenital triangle. The triangle on the opposite side with the ischial tuberosities connected with that drawn line down to the anus is referred to as the anal triangle. So we have the urogenital triangle and the anal triangle within the perineal anatomy. Most of the external genitalia in males and females, as well as the anus, are located within these triangles within the perineal area. We're going to go on a quick break, and when we come back, we're going to discuss some more of this anatomy and physiology, as well as differences between male and female bodies. Stay tuned.
You really can't underestimate the importance of having the right creative work for your brand or your product. Whether it's a logo, a website, a book cover, or an ad campaign, you really need a quality design to make that big difference pop and deliver your overall engagement and success in a competitive market. That's where Design Crowd comes in. Design Crowd has over 750,000 designers from Sydney to San Francisco ready to help you with awesome creative ideas. They make crowdsourcing work for you. So if you need a logo or you're working on your creative branding, you can go to designcrowd.com and post a brief describing the design you need. And then within about 2 to 7 days, you'll receive up to over 100 different designs from designers around the world. Then you pick the best design and approve payment to the designer. So you're only paying for the design that you want. It takes a lot of the guesswork out of freelancing and out of crowdsourcing. And you don't have to be a huge company like Harvard Business School to use Design Crowd, although they have used it as well. You can start a project on Design Crowd for as little as $99. And if you go right now to designcrowd.com/health and wellness or enter the promo code health and wellness on their website, then our health and wellness listeners will receive up to $150 off of your design project. That's designcrowd.com/health and wellness or entering that promo code health and wellness.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
Welcome back. Before the break, we were introducing the concept of the perineum and including the portions around it in the perineal area. We went over the introductory aspects of the musculoskeletal system in that area, and now we're going to pick up where we left off with the urogenital and the anal triangles. As we discussed in our last segment, the urogenital triangle makes up the anterior portion of the perineum, the part that is largely associated with the genitalia, whereas the anal triangle contains mostly the anal area and is the posterior portion. So anterior in the front, posterior in the back. With the urogenital triangle, the female urogenital triangle is a home to the opening of the vagina, the urethra, and the clitoris. The perineal fascia of the urogenital triangle has both superficial layers and those that are deeper in your body in their location. The ones that are closer to the surface have a fatty layer and a deep membranous layer. And the fatty layer really makes up most of the thickened areas of the labia majora and the mons pubis. In males, the fatty layer is a lot thinner and it's absent in the penis and the scrotum. The anal triangle in the posterior portion of the perianal area contains the anus and the ischioanal fossae. And these fossae are really two wedge-shaped spaces that are between the skin and form around the anal canal and the pelvic diaphragm. They hold fat and loose connective tissue, and it helps to support the anal canal while also remaining flexible enough to allow for expansion during bowel movements. The anal region has a few different nerves associated with it, and the blood supply to that area is provided by the superior and inferior rectal arteries. And then your blood is also associated with the accompanying veins. So remember that arteries take blood away from the heart and veins take blood back to the heart. Lymph, on the other hand, drains into the pararectal nodes and the superficial inguinal nodes. So the inguinal area is just going to be really what you think of as typically being your groin. So that's that same area. So you have these lymph nodes near your groin area or in your groin area near the surface. In the male anatomy, the male perineum includes the penis, the scrotum, and the perineal muscles in the urogenital triangle, as well as the anal triangle. The scrotum is that fibromuscular sac that really holds the testes. It's located behind and below the penis, and on the surface you can see the ridge that runs along the midline, and that continues on the penis as well. Internally, the scrotum is divided by a septum of the scrotum. The female perineum, on the other hand, includes the external genitalia, the orifices of the urethra and vagina, and the perineal muscles. Now, the pelvic examinations generally begin with an inspection of these areas. So if you are female and you're having to get a pelvic exam for any reason, that is generally what they initially start looking at. Your external genitalia in general are referred to as the vulva, and that includes the mons pubis, the labia majora, the labia minora, and the clitoris. The mons pubis is that rounded, cushy eminence that is above your pubic symphysis. It's above it and in front of it a little bit. And it's cushy or squishy because it is largely made of fatty tissues. Your labia majora are the prominent folds of fat and skin that help to protect your urethra and your vagina. And the labia majora are separated by something called the pudendal cleft. The labia minora are inside the pudendal cleft, and they are really two folds of skin that don't really contain fat. And the anterior portions of the labia minora unite together at the top to form laminae that become the frenulum and the prepuce of the clitoris. Your clitoris, on the other hand, is a small erectile organ that is kind of analogous to the male penis, although all human bodies start out as being female, roughly, and go ahead and progress from there. Now, this is located where the labia minora meet at the front of the vulva. But the root of the clitoris is really made up of the bulb of the vestibule and the left and right portions of the clitoris. And it makes it look kind of like a wishbone. We'll talk a little bit more in just a second about what the vestibule is specifically. But the glans of the clitoris is a grouping of erectile tissue that has a lot of nerve endings. And the blood supply there is provided by the branches of the internal pudendal arteries, and then going back towards the heart being the veins. The vestibule is a space between the labia minora. This is where you'll find the external urethral orifice and the vaginal orifice. The greater vestibular glands and lesser vestibular glands are on either side of the vestibule portion of the vaginal orifice, and those glands are what secrete the fluids for you during sexual arousal. The anterior vulval area is innervated or has the nerves provided by the anterior labial nerves, and the posterior labial nerves supply the labia minora, vagina, and clitoris. The blood flow to the vulva is provided by external and internal pudendal arteries, and blood is returned by the labial and internal pudendal veins. So in this way, we can see that the naming scheme is very similar. We know that veins take blood back to the heart, so we're talking about where the veins are coming from, whereas since arteries are always leading blood away from the heart, we talk about where that blood is delivered. So in this case, the external and internal pudendal arteries and the internal and labial pudendal veins. The lymph, however, drains into the superficial inguinal lymph nodes, the deep inguinal nodes, and the internal iliac nodes. So those along the groin surface, like towards the surface, the superficial component, deeper into those tissues, and then also near the blades of the pelvis, the part that you really feel as your hip bones, especially in the front. So a lot of times we think as the perineum as being just that little smooth component between the anus and the genitalia, whether that be in male, female, or intersex individuals, or non-binary individuals as well. So in these cases, though, we actually are finding, when we look into the anatomy and physiology, that it's more than just that tiny little piece of skin. It has a lot more going on. Its roof is formed by the pelvic diaphragm, and it has a floor made of fascia and skin. It also has muscles and neurovasculature in it, and it has an association with the urogenital structures and the anus. So the perineum is actually that diamond shape that's divided into true triangles from your sit bones and then up towards the clitoris or the penis, and then in the other direction on the other side of the anus. So that you have two triangles there, and that entire area is the perineal area. Now that we know a lot more about the anatomy and physiology of this area, we're going to go on a quick break. And when we come back, we're going to talk about childbirth and episiotomies. Stay tuned.
You really can't underestimate the importance of having the right creative work for your brand or your product. Whether it's a logo, a website, a book cover, or an ad campaign, you really need a quality design to make that big difference pop and deliver your overall engagement and success in a competitive market. That's where Design Crowd comes in. Design Crowd has over 750,000 designers from Sydney to San Francisco ready to help you with awesome creative ideas. They make crowdsourcing work for you. So if you need a logo or you're working on your creative branding, you can go to designcrowd.com and post a brief describing the design you need. And then within about 2 to 7 days, you'll receive up to over 100 different designs from designers around the world. Then you pick the best design and approve payment to the designer. So you're only paying for the design that you want. It takes a lot of the guesswork out of freelancing and out of crowdsourcing. And you don't have to be a huge company like Harvard Business School to use Design Crowd, although they have used it as well. You can start a project on Design Crowd for as little as $99. And if you go right now to designcrowd.com/health and wellness, or enter the promo code Health and Wellness on their website, then our Health and Wellness listeners will receive up to $150 off of your design project. That's designcrowd.com/health and wellness or entering that promo code Health and Wellness.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter and download us on iTunes, SoundCloud, and Google Play.
Discussing the anatomy of the perineal area. We often tend to think of the perineum as just being that little smooth space between the genitals and the anus, but it is actually a lot more than that. In anatomical terms, it's really going to be that entire diamond shape located within the area of your pelvic girdle. But what most people think of when they refer to the perineum, and this is in the colloquial sense, is that little smooth area. And that's what we think of when we talk about an episiotomy. So now I want to talk to you guys about these episiotomies and perineal tears. We normally hear these referred to in pregnancy, but what do they really mean beyond something that sounds terrifying as a snip to our bodies? So the episiotomy is an intentional cut that a doctor or midwife makes in the perineum. So that is the colloquial sense of it, the area between the vagina and the anus. And it's usually performed to help deliver a baby, or to help prevent the muscles and skin from tearing, or sometimes both. So it depends on how large the baby is, how quick it's coming out, so on and so forth, how far the body is really prepared before we get to that point. So if it is determined that an episiotomy is necessary, then the cut is made just before the baby's head comes out of the birth canal, and a doctor or nurse stitches it up after the birth of the child. Episiotomies aren't really routine though. There are certain situations in which an episiotomy is really called for. So for example, if the baby's heart rate drops a lot during pushing and it gets to a dangerous threshold, or if the baby's position is causing problems in the delivery and childbirth process, then an episiotomy may be necessary. You can't really make that decision until delivery though. This is not something that you technically go ahead and decide in your birth plan like you would regarding whether you're going to have the child at home or in a hospital, or if you want a water birth, and so on and so forth. This is a decision that is typically made in the moment on an as-needed basis. And episiotomies are typically more common with first-time deliveries. The soft tissues in this area haven't really been stretched to this extent for the most part before the birth of the first child. So in those cases, that's why it is more likely to be required for the first-time delivery. Also, routine episiotomies aren't just unnecessary, but they're not recommended. And most experts say that the episiotomy is generally not needed during most childbirths. In the past, episiotomies were a very common component of giving birth, but a lot of doctors no longer do them routinely. A few still do, however. So if you have a concern about that, make sure you talk to your doctor or your midwife ahead of time, depending on which direction you decide to go. If you elect to have a doula present for your birth of your child, also communicate that to your doula and to anyone else who will be in the room with you for the child's birth, should anything happen. That way they can also keep everyone on board with what's going on and your wishes. So now that it comes down to it, a lot of times we discuss in this podcast ways to prevent different things from happening. So can you prevent perineal tears? Well, it's not actually uncommon for your perineum to tear during birth, but there are a few steps that you can take to prevent this. So there is some good news. During labor, you can just be conscious of your different positions that you're in, because different positions may put more or less pressure on that area of your body. Now, granted, I am not here to preach to the people in the world who are giving birth to babies. I totally understand if in the moment you are not paying attention to that, because that is your least concern. But if perineum tearing is really important to you and it is one of your primary concerns, then you might feel more comfortable sitting upright or lying on one of your sides or getting down on your hands and knees for this labor, just to help reduce the likelihood that there will be excessive pressure on your perineum and that it may tear. However, that is not foolproof, and sometimes it will still happen. You should talk to your birthing coach ahead of time so you know how hard you should push and when you should push. So whether that be the person going through the Moz class with you or your doula and so on and so forth, talk to your birthing team in general about this. You can also have someone provide perineal support. And that means that they can push against the perineum to try to help protect it from tearing as the baby stretches it as it is coming forth. Sometimes that's done with a hot, moist cloth. You can also practice perineal massage. So this is often played for laughs in a lot of comedies that are related to babies, like in the movie Baby Mama. But this type of massage can actually help the tissue around the vagina be more flexible and reduce the chance of getting a perineal tear or having to have an episiotomy, because you're kind of coaching that muscle to be more flexible and stretch on its own. It's almost kind of like yoga or a therapeutic massage for that specific soft tissue of your body. Now, if you do end up getting an episiotomy, that intentional incision, or that perineal tear in the area between your vagina and your anus, the colloquial perineum, during your delivery, your doctor or your nurse/midwife may repair it with stitches, and they may also use a local anesthetic for that to numb that general area. And then they'll place an ice pack typically against your perineum to ease your pain and reduce swelling. Recovering from either the episiotomy or that perineal tear can be uncomfortable, even quite painful, and it just depends on how deep and how long that incision or the tear is. And that pain typically can impact everything from sitting to walking to urinating and even your bowel movements for at least a week after giving birth. And as we discovered in the first two segments, that's largely related to the perineal anatomy. So remember, it's not just that tiny little piece of skin. This is going deep into your body, and it is associated with the triangle, that goes up to the clitoral area and the triangle that goes to the other side of the anus. So the urogenital and the anal areas of the perineum. So keep that in mind. That's why it's not just sitting or walking that are painful for this. It's also going to be urinating and bowel movements, because that snip isn't just on this tiny superficial piece of skin. Sometimes the snip or the tear can be a lot deeper in your body. And your first bowel movement may actually be quite painful. Remember, a lot of the nerves that are supplying that area come from the rectal area, and your first bowel movement can really hurt accordingly. You don't have a lot of nerve endings on the inside of your rectum, but on the outside in the anal area, which is not that far from the perineum, you do have quite a few of those. And that's one reason why external hemorrhoids tend to be more painful than internal hemorrhoids. An episiotomy, or a tear in this case, usually heal in about 4 to 6 weeks, but you can do a couple things to reduce pain and promote quicker healing. The first is, of course, to keep an ice pack on your perineal area. So you're just trying to reduce inflammation at that point and the pain. You can also try an anesthetic spray. Your doctor, midwife may recommend regular sitz baths in a tub of warm, shallow water, which is also very similar to different types of treatments for injuries or illnesses in that area of your body. They may also recommend that you take some pain medicine, and some of those medicines can cause constipation, so talk to your healthcare provider for a formula that also may have a stool softener. Take those stool softeners as prescribed or recommended, and drink a lot of fluids to help soften your stools and ease any associated pain. And then use warm water from a squeeze bottle to keep that area clean. You can pat it dry with gauze or a sanitary wipe. And as per usual, especially if you are of the feminine persuasion, we are always told wipe from front to back, never from back to front, to avoid cross-contamination of that area. And you would continue to do this as well, especially if you have had an episiotomy or a perineal tear. Undergoing childbirth can impact your body in very many ways, and in the perineal area, another way it can do that is by really pulling against your pubic symphysis. So where those pubic bones meet at the anterior, the front of your pelvic girdle, and they're attached by that cartilage. So the cartilage really cements them together, but sometimes that cartilage can be kind of pulled from the bone, and the bones are really being pulled from each other as the child progresses through the birth canal. And when this occurs, it can cause some pitting or some marks on the bone, some scars truly on your bone that are referred to as parturition marks, birthmarks. In the past, in skeletons, these have largely been attributed to folks who have given birth. And so many skeletons were assigned the sex of female, or their sex was estimated, as we refer to it, as being female because of these marks. However, over the past few decades, scientists have found that many people who have had injuries related to their legs going too far out to the sides and pulling at those pubic symphyses, pulling them apart from each other, such as maybe the case in skiing accidents in particular, can also result in those marks that appear to be parturition marks. Many anthropologists and skeletal biologists still refer to these as being parturition marks, but mostly do not any longer use that as data to determine that someone was female or had necessarily given birth based solely on the presence of these marks, since other types of injuries that result in hip abduction or leg abduction can really result in this too. That's just a fascinating piece of skeletal biology history I wanted to share with you guys. We're going to go on another break, and when we come back, we're going to talk about the perineal area as it relates to different wellness trends. Stay tuned.
The GSMC Life and Happiness Podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness Podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were talking about episiotomies and perineal tearing, which most often occur during childbirth, but also how injuries related to skiing or any other type that result in the abduction of the legs from the midline of the body can also result in this scarring on the bone that looks very similar to that occurs in the pubic symphysis in women who have given birth. Now we're going to talk about some wellness trends, starting with anal bleaching. We're going to talk about why it's done, how safe it is, its pain, and any potential side effects. I know you're just as curious as I am. So what is anal bleaching? It's exactly what you think it is. It is a cosmetic treatment that lightens the skin around the anal area, around the anus. So one popular method is related to using chemical peels or a chemical type of cream to break down melanin in that area. And your melanin is a natural pigment in your skin. It's what really gives your skin color. These types of products can also reduce the number of melanin-producing cells around your anus. Now, I find that somewhat alarming that it is able to actually reduce the number of cells in your body around that area, but some folks also use laser treatments, and these lasers can destroy excess melanin and slow pigment creation. Neither of those techniques involve literal bleach, as we discussed the definition of bleach in our Don't Drink Bleach episode, and you should not put bleach on your skin. Please do not try to bleach your anus by putting actual Clorox bleach or any other brand of bleach on your skin, especially on your anal area or your genitalia. That can really cause some unnecessary harm and long-term complications. We do not want that there. Remember, as we discussed in that episode on bleach, that the reason your skin feels slippery once you get bleach on it is because it's breaking down parts of your body in that process of saponification. It's breaking down those fats and everything. We don't want that. You don't want that on your hands, and you really should not be getting that on your perineal area. So why do people do this? Well, the skin between your butt cheeks and the area directly surrounding your anus tends to be darker than the rest of your skin color. And that can be due to friction or changes in your hormones or just overall excess pigment. So some folks choose to do this to lighten that area temporarily and make it appear more uniform with the rest of the body. And people tend to do this because it makes them feel more confident in their appearance, whether that be with their partner or perhaps even for a job that they have. But having the skin around your anus be darker than the rest of your skin is fairly normal, and it's nothing to really be concerned about. So this isn't something that is necessary, which is why it's referred to as a cosmetic change. So, is it safe? Yes, according to a lot of professionals, anal bleaching is safe when it is performed properly, using the appropriate techniques and the appropriate chemicals or tools. If you use incorrect anal bleaching techniques or products, that can result in infections or skin damage or even permanent skin discoloration. So make sure that you guys do not try to DIY this one. This is something you should go see a professional for. Now, your next question is probably, is it painful? Well, it may be mildly uncomfortable, but it's not typically going to be painful. They say that anything that is topically applied can cause a little bit of stinging or burning, but it's mild at worst, and that is really referring to like those creams or the gels that are applied to it, those chemical peels. However, if you are getting laser anal bleaching, that may be a tad more uncomfortable. So a laser can sometimes result in a pop or a sting when it first hits your skin, and some technicians, many really, will apply some numbing cream to reduce discomfort. But it's not super strong numbing cream, so you'll likely still be quite aware that it is occurring. You may also feel a little bit of burning or discomfort in your skin once your skin starts regaining feeling. So they recommend taking an over-the-counter anti-inflammatory to help reduce the sensitivity. So a lot of folks recommend taking NSAIDs like that before you go and get other things done to the urogenital or anal areas as well. So it's pretty fairly common and standard for practices associated with that area of the body in the cosmetic context. Now, if you start experiencing severe burning or itching or stinging, you need to immediately alert the person who is performing the procedure on you and seek out a doctor or another healthcare provider, because that amount of pain or sensations are truly outside the norm. So aside from pain, what does it feel like? Well, I've not had it done myself, but folks who have say that it is unlikely to be uncomfortable, honestly. It seems that most folks are more uncomfortable with it from a sociological or a psychological point of view than experiencing any actual physical discomfort. And that goes for topical and laser bleaching. Although it ultimately depends on the type of procedure that you pick, how skilled your technician is, and your overall pain threshold or discomfort threshold. So in that way, it largely sounds like waxing to me. It sounds like waxing in principle anyway. So some folks who get the topical treatments, the chemical peels, or those creams might feel that mild stinging or burning when the product is applied, but other folks don't feel anything at all. Everyone is different and everyone is unique in their individual experiences, and the same thing that goes for the rest of the holistic study of health and wellness is also true for anal bleaching. The same thing goes for laser anal bleaching too. Some folks have these brief bolts, or sometimes they refer to them as pings, in sensation as that laser first hits the skin, but other folks feel nothing at all. And if your tech does use a numbing cream, you might feel a little slight pressure when the laser hits the skin, or you may feel nothing at all. Or if you're particularly sensitive to discomfort, then you may feel more than general individuals do. You also might find that it actually doesn't take that much time, and it could be more tolerable and more comfortable than you generally expect. Are there side effects or risks though? Yes. The risks of the at-home applications include incorrectly applying it, so perhaps getting it too close to your genitals or into the rectum, or getting too much of the product in different places. You may cause permanent damage to your skin, including scarring and discoloration. You may also get anal strictures. So if that bleaching product finds its way into your rectum, you might get scar tissue around the rectum is what it's referring to. and that can prevent the anus from properly stretching during a bowel movement, which can thereby result in a lot of constipation and pain. So this is not really something to mess around with. It may seem very chill, like waxing at home, but you also really want to go see a professional for this. If you go and see a professional, the risks are skin damage, so the chemicals may be stronger than the at-home applications and therefore more likely to cause side effects. You may have a tech who is not properly trained, and if they apply the product incorrectly, you can get scarring, burning, or permanent skin damage just as you could at home. So make sure you inquire about the tech's skills, how long they've been practicing, and so on. Laser damage can also result if it is used incorrectly. So you can go see an esthetician or other specialist for this. You can get consistent results that way and have access to better quality products and the correct application. If you are going to do it at home, I recommend against doing this the DIY way, but you technically can. So if you do that, make sure you're using reputable products. Don't be trying to use products that don't have good ratings and stuff. Do your homework on it. And some lightening products are not well regulated. So that means you might not even know what the ingredients are. So if you're going to do it, make sure that you know what the ingredients are, that the products are reputable, and most people recommend peels, creams, or gels that use something called kojic acid. That's an exfoliating chemical that has largely replaced hydroquinone in the bleaching ingredients. So if you're going to do it, it's most recommended that you see a professional. What can you expect though? Well, that depends on your natural skin tone. Anal bleaching typically will lighten the skin around your anus by a few shades at most. So it may not go to the specific shade that you are wanting. Keep that in mind. And also understand that you should not be performing several attempts at this back to back. You wouldn't do that to your hair, and you should not do that to your anus. At-home treatments often take a bit longer to give you a clear difference because those products aren't as strong. Think about teeth whitening substances as we discussed in the bleach episode and how those tend to be different in the office versus at home. Those professional treatments in anal bleaching might give you more apparent results in as little as one treatment, just like dental bleaching within a dentist's office. The results as well are not permanent. Remember, a lot of the darkening of the skin in that area is caused by hormonal changes and also friction. So walking, running, and sweating can all cause friction. If you get laser bleaching, you probably need touch-ups about every 6 months or so, and the topical treatments may not last as long. You're more likely to have a longer lasting impact of it if you get it done in a professional setting rather than doing it at home over the counter. You should speak with your doctor or a dermatologist to help find a specialist, and they may want to confirm that the darker skin isn't the result of an underlying health issue, as well as to direct you to someone who is safe and reliable. Some dermatologist offices even employ estheticians who are trained in that practice, as do some plastic surgery centers. They may, if nothing else, be able to point you in the right direction. We're going to go on a quick break, and when we come back, we're going to talk about how to prepare for this appointment, what to expect, and also some information about waxing. Stay tuned.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America's Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America's Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America's Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
discussing the concept of anal bleaching, how it works, the different options available, and so on and so forth. Now we're going to talk about how to prep for that appointment and what to expect. So if you're going to get your anus bleached, you should abstain from anal and vaginal intercourse for at least 3 days prior to the appointment, because the friction involved in that can cause small tears that can increase your risk of discomfort and other side effects. You shouldn't perform any sweaty activities, including running or hot yoga, because that promotes more sweating and friction in the area and can make the treatment less effective. You should also avoid hair removal in that area. Doesn't matter if it's shaving, waxing, or another type. It can irritate the skin in that area and make the bleaching more uncomfortable. You should also not wear a thong. Wearing tight underwear or otherwise restrictive underwear, including thongs, can increase the friction too. Reducing the friction can help you reduce the likelihood of sensitivity. On the day of your appointment, just shower and lightly clean around your anus. Wear loose-fitting clothes, including your underwear, and that will help the anus breathe and also heal without the friction. So imagine going in there and getting, essentially you're using chemicals to burn the area into being lighter, and then starting to just rub on a sunburn is kind of the concept. You wouldn't want to do that. That would really hurt. So don't wear a thong to your anal bleaching appointment. Now, when you do go to your appointment, the tech will likely ask you to remove your underwear and go ahead and lie down on your back. They might have you roll on to one side or put your legs on one side to help the tech reach your anus more easily. Then they're going to clean and dry the skin again. If you are getting the laser treatment, you might get a skin numbing cream. Since the other types of treatment involve a topical application of either a cream or a gel, you're not really usually going to get a numbing cream there too, as it can render the other creams less effective. Once your skin is all prepped, your provider or technician will go ahead and apply that treatment or perform the laser treatment if you opted for that over the topical type. Then you'll probably just have to lie there for several minutes to wait for it to work. Kind of like when you go to the salon and get your hair bleached and you have to wait for the bleach to do what it needs to do. So afterwards, you need to abstain from sex for another 3 days after your session. If you're sensitive or uncomfortable in that area, you might need to abstain for longer. So 3 is really the minimum. And your provider can offer you guidance for that based on your individual circumstances. Don't be afraid of reaching out to them to ask about when it's appropriate or comfortable to have sex at that point. They have already bleached your anus. You are now on close terms, essentially, with this type of doctor. I know with my GYN, I will ask her a lot of questions and just be very blunt about what's going on, because she knows me more intimately than most people that I know. So don't worry about that. This person is acquainted with you in a way that many other individuals are likely not, and they are overall medical providers or estheticians, and this is their bread and butter, so to speak. So this is going to be way less weird for them than it might initially feel for you. And having that information is empowering, and it can also really help make sure that you stay as healthy and well as you can, which is generally what these folks want for you too. Your technician will likely also send you home with a lotion, a cream, or a gel to apply to that bleached area to reduce inflammation and avoid infection. If that area gets painful or you start having anal discharge or develop a fever, then you should see a doctor. Those are symptoms of you possibly having an infection. So TLDR, anal bleaching is safe when performed correctly, and you should speak with your doctor or dermatologist first before pursuing it. If there aren't any underlying concerns, they might be able to recommend you a reputable product or tech to help with your goals. Now that said, you guys, I'm always really straightforward with y'all. There are no lies in this podcast. And I am not entirely comfortable with this concept, at least for myself. There are also intersectional issues related to feminism in the concept of using bleach on your skin. So this makes me uncomfortable for a couple of different reasons. First of which is it's totally natural for your skin to be a certain color. If you have a certain amount of melanin in your skin, that is because you are biologically programmed to have that there. And there is nothing wrong with that. Human variation and adaptation can be absolutely beautiful. Diversity can be beautiful. And it really doesn't matter, in my opinion, what specifically that area of my body looks like. If I'm interacting with someone who can see that area and they have a problem with the way that my body naturally looks, in my personal opinion, that person's probably just not for me. And that's just how I feel about it. Remember, Haley Steinfeld says that you look greatest when you feel like a queen. Because when you feel like a queen, then your confidence is really going to radiate outward. Now, I say queen because those are the lyrics to the song, but all of my kings, queens, non-binary monarchs, everyone is welcome to try this if that is something that you'd like. I just wanted to also discuss my personal viewpoint on it and tell you that just like Mr. Rogers says, I like you just the way you are. And I don't think that you need to change that for anyone else but you. If you feel more comfortable changing that for you, then go ahead. But just like cosmetic surgery, I do recommend thinking about your motivations for it, why you feel that you want to do it or that you need to do it, and also what your ideal outcome from it is going to be when you're changing something in your body like your skin tone. Some cultures also advocate for using skin bleaching cream on the rest of the body, not just on the anus. And that can be a form of racism and a form of colorism. That's not really cool in my book. So I am very anti-racism. Colorism is something that is not really for me specifically to speak on as a white woman, but I am saddened that folks feel the need to lighten their skin to achieve a certain beauty goal, or in some cultures even socioeconomic status goals, as all of these issues are truly intersectional in nature. That said, some people do feel that need, and it is not for me to cast judgment in that regard, but I do want to just remember to remind you guys that Mr. Rogers and I love you just the way you are, and you don't need to change a thing to be beautiful. Nor do you have to change anything to be valued or to be worthy of love or anything else. So, if anal bleaching is something that is important to you, definitely speak with your healthcare professional about it. And if you feel that you have some perhaps deep-seated issues related to why you would want to bleach this portion of your body or other portions, talk with a trusted loved one about it. You can also talk with the people that you love and who love you about it, and you can also speak with a therapist as well. Depending on the actual reasons for it, you may want to ask about different types of therapy, and your doctor and or a psychologist may be a really good choice for that, if that is the route that you would like to take. So remember, as always, we are all individuals, but I also like to look at everything from a holistic perspective, and I would be remiss if I were not to point out the intersectional issue associated with bleaching any part of the body. Also, a lot of the time, women's bodies tend to be overly promoted for having natural things done away with them, like cellulite, or hair, or the color of their skin in the form of even anal bleaching. So I also wanted to bring up the intersectional issue as it relates to sex in addition to those related to race. I hope that really covers it for you guys. And we're going to go on a quick break. And when we come back, we are going to talk about waxing and sunning your perineum. Stay tuned.
GSMC Beauty Tips Podcast gives you advice on everything from hair to fashion to skincare products. We'll talk about the latest trends in makeup, hairstyles, and anti-aging remedies. And we'll cover all of the newest fashion trends. If you have an interest in or questions about the beauty trends that might work best for you, the Golden State Media Concepts Beauty Tips Podcast has got you covered. Download the GSMC Beauty Tips Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were talking about the process of anal bleaching, specifically how to prepare for your appointment, what to expect during, and what to do for aftercare and maintenance, as well as any associated risks. Now we're going to talk about sunning your perineum, and we are also going to talk about waxing. So first up, waxing. This is one of the more commonly accepted forms of upkeep in this area of the body. I'm not exactly sure what to refer to it as. Landscaping, perhaps. It's truly, I believe, a cosmetic change to this part of the body and is, like anal bleaching, totally optional and impacted by sociocultural issues like intersectionality. Oftentimes, we think about this wax as being a Brazilian wax, but it's also referred to as a perianal wax or a perineal wax. And as we discussed in our first two segments, that is because it is associated with those parts of the body. The perineum is actually that entire area that is mostly the external genitalia and the anus in the pelvic girdle. So, when you hit puberty, you obtain something that we refer to in anthropology as being secondary sex characteristics. The most common secondary sex characteristics for which you may be familiar with are the hair growth. So on the face, on the armpit area, the legs, your chest or your back, sometimes just depending on your hormones and everything, but also on your genital area. Hair growth is totally natural, and just like other types of fashion related to hair, whether that be the hair on your head or your armpits or your eyebrows, the hair on your genital area is also subject to fads and movements of fashion. So in certain eras, it was very popular to have a large outgrowth of pubic hair. And in other eras, they preferred something that was called a landing strip. So you would have a portion of the hair still intact, but cut relatively short, and everything else shaved or waxed away. And in other cases, sometimes people even went ahead and shaved little symbols in it, like lightning bolts or smiley faces. Or there was also that period where everyone was really into the concept of vajazzling. I was young when that one happened, and I could never quite tell whether folks were truly serious about vajazzling or if that was a joke. I'm still not entirely sure, to be honest, but I'm a little bit concerned about Googling vajazzling with my safe search off. So we're going to just really take a deep dive into waxing specifically. There are so many different ways to remove hair from a person's body. There is Nair and the other chemicals that almost make your hair look kind of like rubber and smell like ammonia.
as you go ahead and strip that off. There's also products like wax, whether that be hard wax or soft wax. Use different ones depending on which area of the body you are removing hair from. There's also threading, tweezing, burning sometimes. I don't recommend that one. Please go to a professional if you are choosing to explore that one, as well as the age-old tradition of shaving. So you can choose from a ton of different options for removing hair from your body. But shaving the perianal area is not recommended because there's a high risk of cuts and infections. You can get cysts down there. You can also get pimples. Anyone who has ever shaved that area knows about the intense itching sensations as well as the hair grows back. And waxing is really the easiest and safest method of removing hair around the anus in particular at home. Waxing also generally lasts about 3 to 6 weeks. So when you are going to go ahead and wax this area, it's important to wash it thoroughly with warm water and a gentle soap. And keep in mind that a large number of bacteria tend to reside in that area. Remember that most of the bacteria in your body are in the lower quadrant of your intestines, particularly in the rectal area. So it's important to clean that very well to reduce the chances of getting an infection from any broken or irritated skin. Then they recommend that you lie down on your back with a mirror positioned near your feet, or you can try squatting over a mirror just to get you a really good ability to see the area. This is, of course, if you're applying it at home. If you get a professional to apply it, or even a very close friend, then it can be a lot easier for you. But you really need to see the whole area in order to appropriately apply that wax. They recommend that you trim your perianal hair to about 1/4 inch with scissors if it happens to be longer than 1/2 inch. Hey guys, we have all been in quarantine. I'm not going to judge you about whether or not you need to use scissors for this. Let's just keep it real. Then we're going to make that hair removal easier and decrease your discomfort during waxing by just making sure that the size is about right. According to the Nemours Foundation, waxing is most effective on hair that is at least 1/4 inch because shorter hairs might not adhere to the wax for removal. So if it's not grown out long enough because you have waxed a lot in the boredom of the quarantine, then go ahead and make sure it grows out to at least 1/4 inch. Otherwise, it might not stick, and then you're going to have to go back behind with a different method rather than just waiting another week. Or just have a bunch of stray hairs. It's up to you. Then you can use one hand to pull the skin on one side of your anus taut and spread the no-heat wax on the area using your right hand and the stick or applicator. They recommend a no-heat wax in this situation because this part of your body is quite sensitive. Then you're going to press that cloth strap against the wax and rub your hand back and forth across it. You're trying to get it to adhere securely to your hair and skin. When you're applying the wax, apply it in the direction of the hair growth. Then go ahead and put the cloth strip down in that direction. If the strips were not included with your waxing kit, you can often get them at pharmacies or beauty supply stores like a Sally's. I have, in a pinch, used a torn up pillowcase. Well, I cut it up. I like to be neat like that. But I tore up an old pillowcase we were going to get rid of anyway to use as wax strips for my legs. This may very well work perfectly fine for other areas of your body, but make sure that the material is clean, of course. But you want to go ahead and grab the far end of the cloth strip, so the end that is going to help you pull it in the opposite direction of hair growth. So lay down the wax in the direction of the hair growth with the grain, and then you're going to pull against the grain. So keep that strip as close to your body as possible at all times. You don't want to pull it out at like a 90-degree angle. You're wanting to pull it back on itself because otherwise it's going to increase pain and inflammation. The reason we're pulling it kind of against the grain is to help it come out the way that it should.
It's going to be more efficacious in the long run and overall less painful. Then you'll go ahead and pull it off. You can remove any remaining wax by soaking a cotton ball in baby oil and then wiping it across your skin. That wax should come away fairly easily. And you can also make sure that you put some waxing gel or a moisturizing ointment into the area to help prevent dryness and ingrown hairs. If you're into more natural products, some folks recommend aloe vera gel. Also, make sure you don't wax over the same area twice in the same day. That goes for any area on your body that you're waxing, honestly. If you're looking for a more permanent method for removing your hair from your body, you might want to look into electrolysis or laser hair removal. Those procedures can be expensive and somewhat painful though, so it just depends. Now, a lot of these principles that we discussed for waxing the perianal area can also be extended to include best practices for waxing around the urogenital area. It is pretty similar in context as to how sensitive these areas are as well. But as always, if you're uncomfortable doing this at home, or you don't feel that you are flexible enough, or you're going to get enough visibility for it, go and see a professional at least the first couple times, and they can really get you used to what can be expected and what it should look like before and after, what it should feel like, so that you can know when you have it right versus when you need to make a few adjustments. Alright guys, now that we have covered the rest of our topics, including waxing, I want to talk to you really quick about the wellness trend of perineum sunning. So this goes by a few different names, including the more colorful term taint tanning, and it started to gain momentum in the past 6 months or so, mostly due to social media influencers. So some folks in this past year posted photos of themselves laying on the ground in the sun with their legs splayed wide and their bums exposed to the sunlight. They claim that just 30 seconds of sunlight on your anus can give you more energy than you would an entire day being outside with your clothes on. Now, that said, a lot of folks, including Metaphysical Megan on Instagram and Raw of Earth, have really been huge purporters of this. And Metaphysical Megan is quoted as having said, "Perineum sunning is an ancient Taoist practice that originated in the Far East, and it is a gateway where energy enters and exits the body," in reference to the perineum specifically. Now, some folks say that they do this because it helps with their sexual energy, or it prevents against the leakage of chi from the body, or that it can also help promote deeper sleep. Those are some of the main outcomes that they are telling you that you can expect. So let's ask a doctor though and see what's up. So dermatologists recommend not to expose your anus to the sun. They in fact recommend against any sun exposure without sun protection. So just like any other part of your body, the perineal area really does need sun protection and clothing to prevent it from getting harmed by sun exposure. That skin is particularly sensitive, and other dermatologists have actually said that it is dangerous. They also say that it can increase your risk of skin cancer. There is also no scientific evidence to support that the behavior promotes any sort of well-being, according to medical professionals, and they say that you can obtain this type of well-being through other safer options, including relaxing, meditation, and mindfulness. So they're not saying don't turn away from Western medicine, they are just saying don't turn your bums towards the sun. They recommend that if you're trying to get a lot of vitamin D, you can just as easily get it from a healthy diet or by going out in the sun with appropriate sun protection and or clothing on. In a more humorous aspect, Josh Brolin, the actor who has played Thanos in Avengers and who also played Cable in Deadpool. And one of my personal favorites, Young K in Men in Black 3. Josh Brolin is a fantastic actor, and he also cracks me up. If you follow him on Instagram, he actually tried this a while back. And he said, "Try this perineum sunning I've been hearing about, and my suggestion is do not do it as long as I did." He claims that he was crazy burned in that area of his body, and instead of getting to go out shopping with his family, he was having to use ice and aloe and burn creams because of the severity of the pain. He did not specify specifically how long he did this, but he did not enjoy his experience with it. So I don't recommend perineum sunning, but you don't have to take my word for it. Thank you for listening to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'd like to ask that you please subscribe to the show, and writing a nice review always really helps us. Also, if you could please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly, and have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.